Thank you very much, Tatiana. I hope you can hear me well.
Yep.
Good. So, hello, everybody. My name is Monse Soriano. I'm originally from Spain, based in Berlin, and working at Bayer for nearly 15 years now. I have a background in medicine, and I also trained in public health and epidemiology. And most of my professional career has been as an epidemiologist in different type of organizations and settings. I am a Bayer Science Fellow, so I love the quote about being excited for the science. That's also my motto. And at Bayer, I currently work as head of a small team within the medical organization, now moving into global commercialization, covering aspects around evidence generation and policy making. Prior to working at Bayer, I spent a good amount of years working in different organizations, primarily in the field of epidemiology of infectious diseases and the development of interventions to prevent and control infections. So a lot of work around vaccines, vaccine development, vaccine evaluation. I spent some time working in Africa, and I actually spent a bit of time, 1 year, working in DRC, the country from where Vivi comes from. I was in the southern part of the country. We never met at that time, but in February this year, I met Vivi for the first time. I joined her at the Bayer Foundation's award ceremony, and today is my pleasure to introduce her to you. Vivi is a professor at the Department of Tropical Medicine at the University of Kinshasa in DRC. She has a background in medicine as well and a PhD in medical sciences, which she obtained at the University of Antwerp in Belgium, where she wrote a thesis on the use of on the evaluation of asymptomatic malaria infections and coverage in endemic settings. At the university, Vivi teaches students. She supervises them on their thesis. She is specialized in teaching in areas around parasitology but also statistics and other areas. And she remains engaged at the University of Antwerp as researcher at the Global Health Institute within the Department of Epidemiology and Social Science. Vivi is very interested in working in the development and evaluation of treatments and interventions towards the fight against infections and neglected tropical diseases. And as part of that work, and I think we will hear about that today, Vivi is very focused, very interested in understanding what is the best type of an appropriate design that should be implemented for those studies when applied in low-income country settings, including operational but also ethical considerations. She's also very active in the field of capability building at the field level and very close to other groups in Africa in close partnership, working together towards prevention of infectious diseases. After more than 10 years of work experience, Vivi came to Berlin, to Leverkusen in February this year, this year was, to receive the early award by the Bayer Foundation on the medical science category. And this was focused, and she will tell us about that, on the work that she has been doing on the evaluation of the safety, immunogenicity, and efficacy of novel drugs and vaccines, again, with a big focus in Africa. Vivi's work is also recognized through her presentations in conferences, publications, peer-reviewed journals, etc. She's an accomplished researcher and a big passionate about all the work that she does. I'm very, very happy to have her with us today, and I'm sure that you will see through her presentation her passion and her love for the work that she does. As Tatiana mentioned, there will be opportunity for questions at the end of the session, and we also invite you to enter comments, reactions, questions also in the chat. And with that, I'm very happy to hand over to Vivi. The floor is yours, and I hope everybody will have a very good session with you today. Thank you.
Thank you very much, Monse. That is a very, very nice presentation, actually. I could not make it better. I will share my screen to begin with the presentation. As Montse just said, I'm really passionate in what I do. So in the development of molecule, in the implementation of trial, and also the design of those trial on the field. And today, with the few time I have, I will try to just like take you with me on a trip to DRC, where you will see what I do on a daily basis. So I will begin with DRC. I just want to introduce you first. So DRC was actually the third largest country in Africa, but now down the Sudan is split, is the second largest country in Africa and the largest in sub-Saharan Africa. And the country has more than 2 million kilometer square. So it's a really huge country that is equivalent to Western Europe. Also, as you can see on this slide, the country is very diverse, considering the landscape. There's the central basin, the rainforest, and the equatorial forest in DRC is the third biggest forest in the world, the first biggest forest in Africa. And in the eastern of the country, there are islands with mountains and some active volcanoes. There are also in the west, the vast plateau that really transition into savanne. And in the coastal plain, there's a Atlantic Ocean. So you see that Congo is one, but really diverse, not only in the landscape, but also in the population. And we have more than 200 ethnicities. So we have languages that are spoken in the country, more than 200 ethnic groups, and the 4 main that are considered as national languages, the 4 main local languages are Lingala, Swahili, Kikongo, and Chiluba. And the administrative language that is spoken in the administration and the teaching language is French. So I'm mainly a French speaker, so you will be indulgent for my English. So you see, as the country, in addition to all I say, is actually a poor country, and it faces also a lot of health challenges. Some of them are just listed in the screen, as you can see. And for the moment, so far, malaria is really the leading cause of illness and death, particularly in children, which is really unfortunate because malaria, it's something that can be avoided. So to define the emerging and tropical diseases is quite easy. They are just a diverse group of conditions that are caused by various pathogens. So they include viruses, bacteria, parasite, fungi, toxin, and they increase in prevalence in new areas. For the tropical diseases, they are more specific to tropical areas. And as you say, in Congo, the country has the landscape is very various, and concerning we have a tropical climate and also an equatorial climate, so we have some specific diseases. And for the emerging and re-emerging country diseases, when you take them together, it's just what is called the emerging and re-emerging and neglected tropical diseases. So tropical diseases really focus in the tropical areas, and essentially for me, I would take the experience I have in DRC, and for the emerging and re-emerging is you can find them anywhere, and the most illustrative case that we can have is COVID-19. So why is it really important? Is it really necessary to address those emerging and tropical diseases, emerging and re-emerging? When I say emerging, please also consider re-emerging included. It's because it's needed to address the global health disparities. It will have to reduce the burden of disease that disproportionately affect the most vulnerable people who have not access to primary health care. And also it has an economic and social component because if people have a better health, it will mean that they will be more productive. Also, it has an impact of preventing disability, improving the workforce productivity, and regarding the healthcare equity, it ensures that innovative treatments can reach all the regions, even those with limited access and limited resources. And that really is the bridge, it bridges the gap in access in healthcare to life-saving intervention to those population. And yes, and also regarding the disease and control prevention, it really has an impact and as an integral and effective disease control and prevention strategy. So in short, we can say that to fight against emerging and tropical disease will help to save lives, but also to mitigate the spread of disease in the more globally. So now, regarding the development of the molecule themselves, it is really a long and winding road in the African context and especially in DRC, because I will share my experience with the DRC, because in DRC, and it's really common with a lot of other African countries, there is a deficit in infrastructures. I have difficulty to say some words. And we have, so there is really a shortage or a lack of well-equipped laboratories and research facilities. And that really hampers the drug research and also the drug development. So, and that's why you will see that most of the phases in those countries, so in our country, in DRC, for example, there are phase 3, phase 4, better at best phase 2, because we don't have the infrastructure for phase 1 trials, for example. And also we have a problem in the supply chain sometimes that can ensure that the equipment and the reagents are available without delay. And also we have a limited access to modern technology because we don't have necessarily the equipments that are very, the equipment, the last equipment on the field. But also we have another problem, because even without that, we can still play a role in developing molecule, as I say, in implementation of trial, phase 3, phase 2, phase 3. But even there, we have a problem with the human resources, because we need those who will have really skills, high skills research. And the problem with us is that as soon as people get skilled, they try to get opportunities abroad, which is normal because the country is poor, and if they can have better life for their family outside, everybody can understand. And that's comes also along with the financial constraint, because most of the funding relies on international and partnerships. So it's not even it's not always easy when most of the money comes from outside. So we also have other issues or other challenges. We are the ethical and logistical issues, because the recruitment of patients can be really challenging in country where there is like mistrust sometimes in the health system. So people sometimes don't understand why they will get involved in a trial and just get drug for free. Or sometimes when they know that the drug are for free, they can just, run to make sure that they are involved in those trials without consideration of ethical issues. And if the research teams are not aware or are lack ethic, it can really be a challenge. It can really be a challenge, and people may get into those trials without really the ethical requirement that I needed. However, despite all I've just said, to be able to work on such field and to make really the field-based research, it's really an opportunity, because then you can collaborate with local researchers and community for better understanding of the diseases. You can also improve the understanding of the specific, those diseases we are more prevalent in low and middle income countries. And also you can reduce the gaps and challenges in the current healthcare landscape. As I said, there are some population that are more vulnerable than other because they are really remote, and also they have no resource to get the health. And also you can get access to diverse population and also unique disease strains that may not be available in some settings. So the field is very difficult, but also it's really a great opportunity because it's really enrichissant. That's what we say in French. But as I say, to make it really a winning experience, you have to keep the scientific rigor and make sure that, despite the fact that the funds mainly come from outside, despite the fact that we do the collaboration with the partner, and that also is really something really great that is done, because we mainly work in consortium. And sometimes we design our trial ourselves, sometimes they are designed outside, but still we have to make sure locally that that research is relevant to the local context. We have to wonder why is it done, and also that it will have an impact on the specific challenges that are associated with our context. So the trial, even those when we have some that are done outside, we have to also always adapt then, because it's really what can be done in European countries or in, let's say, when I say European, American, okay, you get non-African countries, let's say, it's really sometimes really different. And for that, Montserrat understand really well what I say. It's really, the challenges are really different, and we have to have adaptive trial design that can be flexible, because sometimes you will find out that what you wrote is not able to really be implemented, and you have to make amendments that have to be implemented also. And also we need also to acknowledge and address those challenges to make sure that we know how to implement the trials on the field. So it's really an exercise. We can say that it's so. Actually, when I began in the department, because yes, I'm as Montse said, I'm in the Department of Tropical Medicine, and we are mainly focused on research. I did not know that it will be so challenging, but also so satisfying to work in such settings. Because when at the end of the day, despite all those challenges, you are able to really make good research with really international standards, then you can say, okay, at least I've done something that was worth to be done, and you can have, some articles that you can that can be published and that you can be proud of, because you know that from the beginning of the design you were there and through the implementation and all the logistic. Just for an example, this study here that before we get the article, it's just one of the article that came from a study. It was a trial on the Ebola vaccination on a very remote area in DRC, in Chuapa. It was really, really challenging because on that place, there were only one plane per week. So if you go there and that you miss the plane, you have to wait another week to come back. And it was really complicated. And we had to go really, I would just give some more detail later about that study, but also when you know that when you are able to make research on assess the performance of tests that are used, and you know that those tests will really have an impact on the daily management of malaria, for example. This is really something that can, it makes us proud, actually. But also, we have, as I said earlier, to be aware of all the ethical consideration, because, from the beginning, you have to make sure that you will submit your protocol, that there is an ethical committee the ethical committee will review it, also to make sure that the mechanism, all the process for the informed consent, despite, as I said, the context, the poor context is respected, because, as I just said, in some trial, people can just say no, they don't want, because they don't see why they will take something for free. And in other, the trials are the only way they can get access to medicine, because even if those medicine are so they are on trials, because in DRC, for example, the people get, there are no social security, so people pay themselves for the health care. And sometimes the trials are for them the only way they can get drugs. So you can imagine that they would just say yes, yes, yes. And sometimes if you ask them to sign the informed consent, for them it's they just say, you can just sign for me, actually, and you have to say that no, I have to explain you everything. And then so it's really something that the team has to take into consideration, but also we have to take into consideration also the sensitivity of those of the communities, because just for illustration, we were performing a trial with children under 5 years, a malaria trial, and we asked the mother to come back, for those who had fever, to come back because we wanted to see how they were taking the drug. So every every X day to take the drug and to follow the parasitemia. And just the day before the visit, we were calling them. And once we had a male nurse who called a mother and get the husband. And the next day, he came to the trial site because he said, but what happened? How can a male call my wife? How can a man call my wife to say that my child has to come to the hospital? You can imagine. So from that on, we say that, okay, when we have to call mothers, we will only call them with female nurses. So, you know, those are like challenges that cannot be overseen, but when you are in front of them, you have really to, you know, to take it into account, and also to make sure that communities not only participate to, you know, to those trials just for the sake of participating, but also can get some benefit from that. And this, for example, the algorithm for the support of non-related serious adverse events. On that trial, we made sure that everybody that was in the trial could also beneficiate from drug for concomitant diseases, even if it was not related to, so any symptoms that even if it was not related to the drug that was given. But also, in addition to that, you also have to invest a lot in capacity building and in the local research infrastructure. For example, here you can see the picture of the lab. So this is the Ebola vaccine I was talking about. So we need to implement it, but we had to go from the left to the right to make sure that we are able to give really high standard result despite the infrastructure. So you can see how much it is difficult to let the material go to that area, that particular area in Chuapa. We had to plan it month before because all the material had to go by boat from Kinshasa to Chuapa, and it took at least 3 weeks by boat. So it was quite an experience, but you really need to invest in that if you want to make high quality research. So also you have to, you know, to improve the capabilities of the care provider that will be involved also in the trials, to make sure that they know what they are doing, why they are doing it, and they are able to explain to the participants when it is needed. And that is something that is really, really necessary. Otherwise, if they are not able to understand why they have to keep a certain standard, you will not be able to make high quality research. And for the implementation itself, it's really something, as I said, that needs to be, it's really something that for which you have to monitor a lot and also be able to assess the challenges, to identify the challenges and assess them as they come. And as I say, sometimes you have to be really flexible, and if needed, to submit amendment to the regulatory authorities to make sure that you can implement it in the field. Yes, so to finish, so I want you to see my picture. Okay, like this. So really, it is really, it's not easy to hold the research in poor endemic setting, especially when they are remote setting. But it really is satisfying because you participate to the community improvements, and you are dedicated to enhance and transform the life through impactful research, and also to, to be able to strive the excellence as a continuous process, as that is really satisfying, because it led to a positive change, an improvement in the health of people when they will be able to get the drugs, and also the pharmaceutical industry, the scientists, the authorities, all of those are really necessary in the process, because without the pharmaceutical industry, we have no drug that we will use on the field, or drug that we will evaluate on the field. Without the scientists, we will don't have people who will go and make perform the studies with high standard. Without the authorities, we will not be able to have, that regulatory templates needed to make sure that everything is done properly. And also, without the communities, actually, you cannot do anything, because you cannot do something without the participation of the people who are involved. And also, so just to say, for the last, my conclusion is that there are more to do research is really an opportunity to shine while improving communities' life. And I really said, I'm really passionate about that. And I say thank you once again to Bayer for the prize. It was really something, it just it helped to show people that, okay, what you do, it's taken into consideration, and also for the the assistant in the whatever, they can see that, okay, it is it's not easy, but it is something that people take into consideration, and that's really. And also for, we receive a lot of funds, so also for those EDCTP, CP, or whatever, really thank you for you to take the health of African community into consideration. So thank you very much. And for all of you who was there. Thank you.